Are hot springs safe during pregnancy? Are hot springs safe during pregnancy? This is a question many expectant mothers might ask, especially when planning a trip to beautiful destinations like Iceland. So, let's break it down. First, the water temperature is really important. Hot springs can raise the mother's core body temperature, which might lead to complications. Most experts suggest avoiding hot springs that are hotter than 38 degrees Celsius or 100 degrees Fahrenheit. Prolonged exposure to hot water can also be risky. Next, the timing in pregnancy matters a lot. Soaking in hot springs might be safer during the first and second trimesters. However, it is generally not recommended during the third trimester, especially as the delivery date approaches. This is due to the increased risk of premature contractions. When it comes to how long you should soak, keeping it to 15 to 20 minutes is a good rule of thumb. This helps prevent overheating and reduces the risk of circulatory stress. It is also wise to avoid direct hydromassage jets on the abdomen, as they may cause discomfort or complications. If there are any pregnancy complications, or if the pregnancy is considered high risk, it is essential to get medical clearance before visiting hot springs. Now, let's talk about the mineral content of the water. Generally, the composition of thermal waters is not a concern unless they contain unusual elements, which is rare. It is always a good idea to check with the spa staff about the mineral content. For those considering a trip to Europe, many popular hot spring destinations, like those in Iceland or Italy, offer various pools with different temperatures. This allows pregnant visitors to choose milder, safer options. Open-air thermal parks often provide guidelines for pregnant guests, including recommendations to avoid swimming or diving and to keep the head above water. If you are pregnant and planning to visit hot springs in Europe, here are some tips. First, consult your healthcare provider before your trip. Choose pools with moderate temperatures and limit your soak times to under 20 minutes. It is best to avoid hot springs in late pregnancy or if there are any pregnancy-related risks. Always follow the specific guidelines provided by the spa and ask about the mineral content of the water. Hot springs can be enjoyed safely during pregnancy if you take the right precautions regarding temperature, duration, and your individual health status. European hot spring resorts often cater to these needs, allowing pregnant travelers to enjoy the relaxing benefits of thermal waters while minimizing risks.